one of the most frightening problems facing our families today, the explosion in the use of heroin in the Commonwealth of Kentucky. Talk to some of the families circulating through the Capitol today, and you'll hear agonizing descriptions of what this drug is doing to our people. It's killing our family members, and it's causing untold emotional and financial damage. And that problem is getting worse. I'm confident that this session will produce wide-ranging legislation that will attack this problem in a variety of ways, on both the enforcement and the treatment sides. But we don't have to wait to take another important step, a life-saving step. I'm here today with Attorney General Jack Conway and First Lady Jane Beshear, two people who have been leading the efforts to end Kentucky's drug addiction. And we're making an exciting announcement that will literally save lives. Through the Substance Abuse Treatment Advisory Committee, the committee that I created last year, we're making available some 2,000 heroin overdose reversal kits to Kentucky hospitals with the highest rate of heroin overdose deaths. These kits contain the drug naloxone, also known as Narcan, which immediately reverses the effects of a heroin overdose. Overdose patients will receive a kit free of charge when they leave the hospital, so they or a loved one can prevent another overdose event and possibly save a life. Attorney General Conway will detail where the kits will be provided and how this program will work. They represent an important step in this fight against heroin, but it's only a step. I join with Kentucky families, with our Attorney General, with our First Lady, with both law enforcement and health care and treatment officials around this state in urging our General Assembly to make this one of their very top priorities. We cannot delay any longer. Let me ask Attorney General Jack Conway to come up. Jack?
Good afternoon. Happy New Year, everybody. Thank you, Governor. I appreciate the kind introduction and your partnership in this fight against not only the epidemic of heroin, but our continuing prescription pill problem in this state and everything that we've worked on together. You know, it's ironic. It was exactly 1 year ago today that I stood here with you, along with Governor Beshear and First Lady Jane Beshear. We were in this very room, and we announced that my office had secured $32 million in settlements with two pharmaceutical companies. The judge in that settlement ordered that the money be used to expand drug treatment in Kentucky. And pursuant to that, Governor Beshear created the Substance Abuse Treatment Advisory Committee to prudently and in a public fashion administer these settlement funds. And I chaired that committee with the First Lady by my side at nearly every meeting. And in less than 1 year, we've dispersed almost $19 million to 19 programs in every region of Kentucky to expand adolescent and juvenile treatment in this state. In addition to that $19 million, we've also provided scholarships for over 800 people to complete treatment at Recovery Kentucky centers throughout the Commonwealth. We've added funding to complete the construction of a Recovery Kentucky center in the Ashland area. We've kept open 2 treatment centers that were about to close who provide services to pregnant women, and we've also provided transitional housing for those completing treatment. This money is now in our communities, and it's making a difference. It's saving lives. And that's what today's announcement is all about. With about $105,000 that we had in the SATAC accounts, we are going to be purchasing over 2,000 Narcan rescue kits or naloxone rescue kits for the University of Louisville Hospital, the University of Kentucky Hospital in Lexington, and the St. Elizabeth's Hospital System in Northern Kentucky. And I hope the group of folks there in the rotunda who call themselves Northern Kentucky Hates Heroin understand that some of these kits are coming to the St. E system up in Northern Kentucky. Naloxone, which is also known, as I said, as Narcan, has no potential for abuse. It immediately reverses the effects of a heroin overdose by physiologically blocking the effects of opiates. And these Narcan kits are going to be provided free of charge to everyone treated and discharged as an overdose victim at these pilot project hospitals. And these 3 hospitals, according to the data, are the hospitals that receive the greatest number of heroin overdose patients in the Commonwealth. Now, this is important because when a patient who comes into the ER walks out after a heroin overdose, if they get this kit, they're not going to be walking out with a prescription that they can't afford to fill because Medicaid doesn't cover it. They're not walking out with a piece of paper. You know, sometimes if they have a prescription, most of our pharmacies in this state don't carry Narcan. In fact, a lot of our ERs in this state don't carry Narcan. Narcan, for the most part, is not covered by insurance or Medicaid. So they will be walking out, they and their families will be walking out of our ERs in our most affected areas with a medication that could potentially save their lives. This is a pilot project, but let me say this loud and clear. The Substance Abuse Treatment Advisory Committee hopes that we can soon expand this program to 17 more Kentucky hospitals and hospital systems. And we're also hopeful that the FDA will soon approve naloxone or Narcan in a nasal mist. And it is our anticipation that if they approve that mist, then Medicaid would begin to cover that particular prescription. I want to personally thank Audrey Haynes, who did a remarkable job as a member of the task force along with the First Lady. I would like to thank Van Ingram, our state's drug czar, and in particular, I want to thank Dr. Alan Brenzel, the director of the Department of Behavioral Health. Dr. Brenzel did the lion's share of the work in assessing where this money could make the biggest difference. And I'll never forget it, at our most recent SATAC Advisory Committee meeting, I was sitting next to him, and we sort of thought we were wrapping up, and we realized that we had this one item of business that we could take up, taking this extra money and providing it to the hospitals. And he started talking about the costs of these kits at between $30 to $50 a kit, and the fact that we didn't have enough of them. Pharmacies didn't have them. And if we did this and sent 2,000 of these kits to our 3 largest hospitals that are dealing with this problem, that we would literally save lives. And so when the vote was taken and it was approved, I was sitting next to Dr. Brenzel, and I saw his head go down, and he just kind of nodded. And I looked at him, and he looked at me and said, "We just saved lives." He said, "I know this for a fact, we just saved lives." And it was one of those little poignant moments that you get in public service. And I don't think you in the media were there covering it, although it was an open meeting, you weren't there. It was one of those moments I'll always remember, because while it was maybe a small detail on an agenda in a task force meeting, it left a profound impact on me. So Dr. Brenzel, thank you for your focus on this issue, and thanks for what you did that particular day. You know, folks, unfortunately, heroin is on the rise in the Commonwealth. It's filling our jails, our courts, our treatment centers. It's killing Kentuckians. In fact, in 2013, 230 of our fellow Kentuckians died from a heroin overdose. And that's more than a 200% increase from just the year before. And the final numbers from 2014 are not in yet, but we anticipate they very well could go up. We're seeing these deaths increase in every corner of the Commonwealth, in every neighborhood, in every socioeconomic group. This project will allow us to get this medicine into the hands and the homes of the people who need it most. Heroin and opiate abuse is killing Kentuckians, and these kits are going to save lives and hopefully lead to treatment for their addictions. In addition, I hope the legislature, although I was disappointed at the end of the last session, I hope they take heed of what's happening in the rotunda today and the step we are taking today. And quickly, and without partisan bickering, I hope they put politics aside and pass meaningful heroin legislation that will do 4 important things. Number 1, stiffen penalties for large-scale traffickers. 2, increase treatment. 3, bring this state into to provide a Good Samaritan defense for those who call in an overdose. And number 4, get these Narcan kits into the hands of first responders, not just EMTs, but firefighters and law enforcement who want to have them and who also want to have immunity from administering this particular dose of the antidote. Folks, we can't arrest our way out of this epidemic. There aren't enough jail cells, and there aren't enough courtrooms to fix this problem. The time to act is now. And Kentuckians are counting on their elected officials like us and their legislators to help with this problem. Now, I'd like to invite someone who's been a true partner with our office in this effort to combat the scourge of drug abuse in the state. I'd like to invite the First Lady, Jane Beshear, up here to make some comments about why this announcement today is so important to Kentuckians. First Lady Beshear.
Thank you, Jack, and thank all of you all for being here today. You know, this is a terrible time in Kentucky as far as substance abuse is concerned, but the good news is that we are on the way to do things to change Kentucky, to change the lives of so many people. And I'd like to say, Dr. Brenzel, that it's been a pleasure working with you. His knowledge, his work for so many years, and his dedication to the people of Kentucky is just phenomenal. And he has been our sage advisor through all of this, and so thank you. Substance abuse is everywhere. I don't suppose there's a single person in this room that doesn't know someone that hasn't been affected. It's tempted to think that drug abuse of any kind happens to other people, someone that we don't know. But in fact, we all know some family that has been affected. It doesn't matter whether you're old or you're young or you're rich or you're poor or you are a woman or a man. Substance abuse knows no boundaries. Some of these people are our friends. They might be our neighbors. They might be young people that we knew as children. And it's devastating to families. It's devastating to the state. And right now in Kentucky, no drug is more harmful or more tragic than heroin. It's highly addictive. It can kill almost immediately. It's cheap, and it's becoming increasingly easy to access. Kentucky is on the verge of an epidemic. In my role as co-chair of the Recovery Kentucky Task Force and as a member of the Substance Abuse Treatment Advisory Committee, I've had the opportunity to visit recovery and treatment centers all across the state. I've talked to people in recovery. I've talked to their families and their friends. And they all say the same thing. Thank God I've had the chance to get sober and turn my life around. They and their families are grateful for the second and sometimes the third or maybe even the fourth chance that they're given. And I believe that everyone deserves a second, a third, or a fourth chance. By funding these Narcan kits for St. Elizabeth, for U of L, for UK, SATAC is giving people a real chance to put people on the road to recovery. By providing these kits to heroin overdose patients after they've been treated, we're giving the life-saving drug to the community. We're educating users, their family, on how to administer the drug, and potentially we're saving hundreds, maybe even thousands of lives. Often a near-death experience is just the impetus that's needed to convince a user that they need help. SATAC agreed unanimously to fund the Narcan kits because we know that treatment is ultimately what will make a difference to a heroin user. We all agreed that they deserve to have the chance to change their lives and those around them. I believe in second chances. I'll continue to advocate for increased access to treatment, enhanced treatment, and policy measures that give people the opportunity to become sober, productive members of society. Thank you, Jack. Thank you, Steve. And thank you, Dr. Brenzel.
Governor Llewellyn, I know you're out there. Please come up here. There you are. You were supposed to be up here to start. You know, Lieutenant Governor Llewellyn is now heading up our Kentucky Health Now initiative. That is an initiative to attack a lot of long-term weaknesses that Kentucky has in the area of health. One of those weaknesses is substance abuse. And so she will be leading the charge in a lot of very broad ways of attacking that problem. Governor,
Won't you come up and say a few words?
Thank you, Governor Beshear. I was honored when Governor Beshear asked me to join his administration, but especially interested in the initiative he has taken to put Kentucky at the forefront of creating a healthier population. And I believe that's our challenge in this final year of the Beshear administration, especially as far as I'm concerned, is to be sure that all the initiatives that have been put forward have the momentum they need to carry forward with success into the future. And this announcement today is yet another opportunity to be sure that we are taking every step possible to create a healthier population, and a population that is getting the support they need and deserve from its leadership. So I'm honored to be part of this and look forward to continuing to work to advance the governor's reforms in the health community. Thank you.
All right, are there any questions?
Governor, when do you envision these kits being available?
Jack?
I'll defer to Alan on this, but it's almost immediately. We can get the drug to him pretty quickly. The money's available, and we can quickly reimburse any costs they may have. Is that fair to say, Alan?
That is fair.
Yeah.
Our goal's within a month to have them
Yeah.
at least one of the hospitals, and then very quickly the others.
Actually, three questions, all interrelated. First, when the victim goes in, when he or she leaves, do they just give it to them, or does it have to go to a loved one? Secondly, this is a question for the governor and the attorney general. Is there any of the particular bills that are floating out there that you guys ascribe to that you like the most? I guess it's just two.
Just regarding the kits, the most important thing is that they're available. Obviously, an individual who's suffering from an overdose is not capable of administering it to themselves. So the goal would be to train that individual, but also family members and other bystanders, so that in the drug community, the more we can saturate the community with the availability of these kits, the more likely it is that in a setting where someone needs it, one will be available. But the kits do come with training materials, but also more importantly, they come with treatment resources in the kits. And so again, as the First Lady mentioned, our hope is that the kit is the first step for that person entering into a treatment. But
I remember the third thing as a follow-up to any of you on that particular point. There are some who would say that this is a potential enabler, much like the anti-needle exchange argument goes. How do you answer that potential criticism?
I mean, I just don't think that criticism has any particular merit whatsoever. If you talk to individuals who are addicted, they're interested in treatment. They often want recovery. The idea that somehow someone would use more or more often or begin to use because of the availability of a Narcan rescue is a preposterous, unscientifically supported notion. There's no evidence that this would promote or encourage use.
Well, let us follow up with the rest of it, and then we'll go on. And on that last question, what we're talking about is saving lives. You go ask any of these families that were out here in the rotunda today who have lost a loved one, what's the most important thing in this process? And they'll tell you it's saving lives. They've lost a loved one, but they're determined that others aren't going to have that kind of consequence if they can do anything about it. And that's what this is about. We can make all the political arguments in the world, but the bottom line is this is one way we can save lives.
To your point, I just want to echo what the governor says. I mean, that term, as someone that's dealt with addiction and seen addiction firsthand, the term don't enable somebody is one that gets thrown out. It's awfully hard to enable someone who's passed away. I know that's stating the obvious, but this really and truly is, when you listen to someone as passionate as Alan Brenzel talk about this and what he's seen from the evidence, and the fact that with this amount of money, getting this many kits, the number of lives that we can potentially save, that's why it's such an important day for me to be able to say this. So I don't think that term enabling really is appropriate to the discussion we're having here about what we're trying to do. As to the second part of your question, which I don't think has been addressed yet, I asked my staff this morning, I think we now have 10 separate heroin bills that have been filed. It was about 13 months ago that I stood in my conference room just across the hall with Katie Stein and John Tilley and announced that we had worked with them in a bipartisan fashion on a piece of heroin legislation that we want to see passed. It got all the way to the House chamber on the final night and didn't pass. And I was tough on my own party that night in my statement because I thought it should have passed. And in coming up to this session, what I didn't want to have happen here was to have this get overly politicized. Deb Yetter's colleague Joe Girth has already written a couple days ago that nothing's going to pass that has my imprimatur on it because I'm running for governor. So what I did, he did write that, Deb. I saw you shaking your head, but he wrote it. But what I thought was important was several weeks ago to get together with law enforcement, with LMPD, with state police, with the sheriffs around the state, prosecutors, people like Michael Connell who've seen this firsthand, and say, look, there are a lot of bills out there. Some have some provisions, others don't. But from the standpoint of law enforcement, from those of us who see it firsthand on the streets as police or as prosecutors, these are the 4 things we want to see in any bill. And there's some good bills out there. Some bills need some language cleaned up. A few of them have some language in them that actually create more problems than they solve. And my office is willing to work with Democrat or Republican, House member or Senate member, to get the bill in a position where it's ready for passage and where it does the most good in dealing with this epidemic. But my reason for coming forward and saying I want these 4 things in the bill was to make certain that those who are jockeying to pass a bill understand it's time to put people over politics and let's get something done that can help those people on the streets.
With 2,000 kits, how long are those anticipated to last at these 3 hospitals?
Well, I think part of that, unfortunately, we're in a situation where there is a potential shortage of this medication, and so the price is fluctuating, so we can't tell you exactly, but our initial estimates were that we could get the kits for around $50. We're going to use, the hospitals are contributing staff to do the training. We're preparing their treatment and resource materials internally to go in the kits, and we're trying to minimize the cost. But, that number comes from dividing that amount of money by $50 a kit. Now, there could be some fluctuation in price, but our goal, again, is to get as many kits out there, establish the process, have the hospitals get invested, and then over time, it's our thought that third-party payers, including Medicaid, would be able to reimburse for the kits.
On that point, is there going to be, if let's say there's a run on them early for the first half of this year, I know that in St. E's case, for example, they had a huge spike in December, which pushed them up above 700 for the year. Would that, is there more available potentially? Is there more funding available? Potentially expand?
I mean, I think at this point we have an allocation from the SATAC. We would revisit. We hope there's enough kits dispensed that we need to find more funds to dispense them. So our goal is to use what we have, establish a process. There are community groups that are interested. I think Northern Kentucky hasn't waited around for state government to solve this. There are community groups up there that are already dispensing kits. So there are many resources, I think, that can be brought together. But part of it is educating the medical community on the importance of these kits, making sure people are comfortable with the process, making sure we have the training materials prepared, the kit contents prepared, and I think we can find funding to expand this over time.
Well, how does this physically work? Forgive me, is the state providing the kits, or are you all going to provide the 3 hospitals with money after they purchase the kits as reimbursement?
Well, let me say, I'll get your question in a second, John. Alan has taken a look at the numbers. We had 230 deaths in 2013. It's a minority of overdoses that result in deaths. As you said, about 700 at St. E's last year. Looking at the 2,000 kits, these 3 hospitals get 60 to 70%, I think, of the overdose ER visits. We think it'll last about a year. But this is an important first step for this year. So as Alan Brenzel said, we can start educating the medical community and telling people in our hospitals that, look, this simple kit here, this simple kit that costs less than $50 if given to the victim or the patient or a loved one can literally can change lives and save lives. So that's what we're trying to do, and hopefully this will be an ongoing process of looking for additional areas of funding that we can continue this effort.
On the actual kits, forgive me, my first picture was a truck with 2,000 kits going around making sure to get. But no, you're saying that the hospital will go out on the market and purchase.
They can get them, and if we're buying them in bulk, we think we might be able to get them more cheaply than buying them one off at a time. So we're going to be working with the hospitals, but the hospitals are actually going to be doing the purchasing, and then we'll be doing the reimbursing. I don't think anyone wants to get state government into the Narcan purchasing business right now. A couple of things. Not a lot of insurance, and Medicaid doesn't cover this, Narcan or naloxone. So, and it literally reverses very quickly. So because it's not reimbursed, not a lot of our ERs have them. You know, you'd think all of our ERs have them, but not a lot do. Certainly these three are on the cutting edge of it. Not a lot of our pharmacies have them. So if you have someone walking, Deborah, out of an ER post-overdose with a family member, they may have a prescription, but if they don't have insurance or don't have Medicaid, they can't get it filled. They don't know where to go and couldn't afford it in the first place. And if you give them or their loved one something like this, you might save a life. So that's the problem. The FDA is, as I said in my remarks, is in the process right now of potentially approving Narcan in the nasal mist form. And we anticipate that it then could be reimbursed by Medicaid, which would be a significant step. In addition, there's some language in current statute, Deb, that needs to be changed. I keep talking about making certain our first responders have access to Narcan and are absolved of liability when they administer it. And Mitchell Denham, who's here in my office, can tell me there's one particular provision in the statute where it talks about person versus patient, or it makes it questionable whether or not a first responder, like a police officer, can administer Narcan. That needs to be changed. That needs to be changed. Right now, a lot of our EMTs will have Narcan, but our firefighters and police do not. And they need to, one, have it, and two, if they find someone in dire straits and they administer it quickly, they need to have legal protection to be absolved of any liability for administering Narcan in those exigent circumstances.
You mentioned the two pharmaceutical companies that are footing the bill to the settlement. Forgive me, I don't remember which two companies were these.
It was Glaxo, SmithKline, and the maker of Vioxx, Merck. Yeah.
Anybody else?
One other thing, you mentioned possibly expanding it to 17 more Kentucky hospitals and hospital systems. Do you all have an estimated ETA on that, either in terms of time or how much that would cost?
You want to take that, Alan?
I think basically that number, when we look at ER overdose deaths or folks who present, we'll go down the list as funding becomes available. But again, I don't know that we have a specific timetable. Part of it becomes how many kits do we dispense, how quickly are they dispensed, and then how quickly can third-party payers. But we're pretty convinced, and actually now hospitals are coming to us and saying, can we participate? We see these folks every day. People are presenting on a daily basis, and that number is basically looking at who presents in what order and trying to address the numbers and the order of frequency. So we're starting with our urban university settings in St. Elizabeth's, but very quickly, this is a statewide problem, and lots of hospitals need this.
How much money's left in the fund?
Well, it's all been transferred. It's no longer within the accounts of state government. So it's currently there may be a little bit left. I'd have to double check on that.
Anybody else? Thank you. Good job.
Thanks.
Good job.